Hello. Thank you so much, Eliza, for joining us. I'm so excited to interview Dr. Eliza Etter from Beyond Basics here in New York City. She is a fantastic PT, and especially as we're ending EDS Awareness Month, I thought she would be a perfect person to come on and chat about the multidisciplinary care needed for complex patients, any kind of patients that she sees. Um, Eliza, if you take it away and give yourself just a little intro, who you tend to see and what kind of work you tend to do.
Yeah, thank you so much for inviting me, Kelsey. This is really wonderful to be able to talk with you today and to share this conversation with the public. So, like Kelsey said, I'm a physical therapist here in New York City. I specialize in treating pelvic health and all related conditions. So, what that looks like is we see a lot of people with chronic pelvic pain, EDS, Ehlers Danlos Syndrome, hypermobility disorders, endometriosis, and then the whole spectrum of conditions that deal with bowel, bladder, or sexual dysfunction. And
Mhm.
so we see a lot of people who have multi-system involvement, a number of things going on in terms of symptoms at the same time. And then also, it's really an area that is often more challenging to talk about and to seek care, or to so many times we have people come in who feel like they're the only one that are suffering with these symptoms, because it's an area that we sometimes stay more quiet about and is not really openly discussed as much. So
There's such a stigma with pelvic health in general, and that is something that's really hard to explain, maybe to other people in your life too, or if you have, a broken arm, it's easy to talk about because people can see it. This is something that a lot of these conditions you're describing are very invisible. And as you mentioned, that multi-system involvement, what do you find is a challenge specifically like this trifecta and the EDS, POTS, MCAS patient?
yeah, so that multi-system involvement in itself has so many things that can be challenging along with it. So being able to get to a number of different providers, right? So it often involves many more providers. We're obviously hugely think that interdisciplinary care is so important, but when it's like, oh, you have 5, 6, 7 providers to manage all of these different symptoms and systems, that can be extremely overwhelming to us mentally, physically, just trying to get to all of these different appointments and get all of the different care. And along with that, it often ends up being a longer journey to diagnosis or to appropriate diagnosis and treatment. So unfortunately, we see, as I'm sure you do, so many times that there's those misdiagnoses along the way, and maybe even potentially interventions that were not helpful or maybe made things worse in an effort to absolutely try and make things better. But it creates this much longer journey, and then unfortunately medical trauma sometimes along with that.
Absolutely. And the mental load of juggling those appointments and financial time, like it truly becomes another job. And you're, like you said, dealing with the medical trauma along the way. One thing about you, I know, and the practice is that you guys are so trauma informed and really value that interdisciplinary work. And obviously that's why I'm doing these interviews, is because I value that multi-system approach too, and being able to have, a team can create that stability. It is obviously a juggling act and a challenge, and also so needed. But I'm curious, like thinking about the stigma piece too, um, I'm wondering if you notice any challenges and narratives around mental health that you might see with the trifecta patients, or really any patients that come in.
Yeah, I mean, in a number of ways, I think the stigmas and feeling like it's isolating, right? Because it's something that you can't, or people feel like maybe they can't share, or so often it's something that people come in and they feel like they're the only ones that has this condition. There's no one else that they know of in their life who does. And then one of the kind of exciting things about doing this work and being able to educate and connect people with, different providers, and they start to feel more comfortable talking about it. And then they actually find out, oh, my friend actually has something similar, or this person at work came up to me because I mentioned this thing and they realized that they have it too, or, felt like they were the only one. And so I think that's one of the exciting things about doing this work, but it's so challenging when people are initially on this journey in feeling that stigma. And then also many of these conditions are invisible, like you said, right? If you have an elbow injury or you're recovering from a knee surgery, right? Those are much more visible. People understand what that is. And so when someone sees someone who maybe looks very healthy and they're using an assistive device like walking poles or a cane, they're kind of confused by that, or they don't really understand, or why do they need it sometimes and not other times? Because obviously so many of these conditions, especially in like menstruating people, can really change over the hormonal cycle, or just what is their load like during that day, right? Did they have a much more physically taxing day that day or the day before? And so they need more support today, but they didn't need it yesterday, right? Which is different often than what we see if someone has this kind of what we think of as a traditional trajectory healing pattern, where it's like, okay, you're going to PT, or you're taking this medication, or you have this surgery, and then there's these steps to getting better. And especially with the trifecta, because there's if you have MCAS and you are in an environment that triggers that and you have a reaction, you're going to be able to function so differently than if you're not being triggered and you don't have this cascade of inflammatory system going on in your body. And then I think that also triggers the nervous system, or we know that triggers the nervous system, right? And that there's that interconnection between what's happening in our physical body and then our nervous system, and how that impacts inflammation and hormone regulation. And then we get into this cycle of, pain or limitation because of the inflammation that's happening, or the limitations in movement. And then that's feeding into this cycle, which is why, the mental health care especially is so important in these chronic conditions, this trifecta of these multi-system involvement. And sometimes it's really hard for us to even make progress in PT, or for them to see, benefits from some of the other treatments that they may be doing if their system is in this hypervigilance, right? Which often happens. And that's a good thing in the sense that, right, we want our body to be protective when it needs to be. And that's amazing. But usually that's the most beneficial in short term. And when that becomes more chronic, then there's actual physiological changes happening in the body.
Absolutely.
And
absolutely.
Yeah. So I think that is something that also there's that stigma of like, it's in your head, right? So many people are told because they have a condition that maybe was misdiagnosed and someone was like, no, your imaging looks fine and we can't see anything. So it must be in your head. And, the way we sometimes talk about it to people is like, well, arguably everything's in our head because our brain and our nervous system control everything. However, it's not that it's not real. And not only is it real, but there's this interaction of, okay, what's happening in terms of the overwhelm that you're feeling, and then how that is causing these shifts physiologically in your body. And then that's impacting your healing and resiliency. And, so having this multidisciplinary approach to be able to treat people as whole people and not individual systems.
Absolutely. Not in silos. And everything that you're describing about like dynamic and invisible disabilities, the stigmas and the misunderstandings that come just from that is a huge barrier of trying to, that's a big mental load to feel like you have to educate other people in your life, or
Yeah.
it's hard to know where you stand with your own identity. Um, but again, that importance of, it's not, yes, it's in your head that our brains and our nervous system, yes, that is factual. But I agree. And I feel as a patient first, I always say, like, the psychosomatic experience for me, that is going to be the exception, not the rule. Like, I want to come in and say, I believe you. There is a physiological thing happening. Our anxiety and depression and all those things are comorbid with pain, right? How can
Mhm.
we address both? And let's come first from a place of, I hear you, I believe you, I understand you. There is something physiologically happening. And you're right, you described that interaction so perfectly, and that guarding that happens, and downregulation is a part of the healing process, but it's certainly not the thing that is causing all these other things in many of these cases, especially our complex patients.
Exactly. And one of the ways that I like to help describe it to patients as well is like, this is going to help you heal faster, right?
Yeah.
Because if your nervous system is in a better place, then there's more resources in your body to go towards healing, right? Not that your nervous system or your fear or anxiety is causing these other things, but it's so much harder because that's what your brain and your body, more than your brain, right, is putting first, because it's like, this seems like the most dangerous thing, and so we're just going to stay in protection mode, and we can't be in protection and healing mode simultaneously, right? We can
Mm,
go in and out of those, which is, right, something that, like, you have so many tools that you give your clients and your patients to utilize, right, to be able to get out of that. And that's one of the huge benefits. So then it's like, okay, you can go for the walk because your body's not trying to give you all these warning signals about why maybe you shouldn't go.
exactly. And both, I think this is like a lived experience of dialectical thinking and dialectical experiences, that two things are true, that you can have a physical diagnosis in this complex health panel, and that doesn't mean that therapy is going to minimize what you're feeling. Like, it is not irrational to think those things. It's a
Mm-hmm.
product of medical trauma, and we can help you get unstuck, right? So that the PT is more impactful, and then your mental health gets a little bit more stable over time, right? And it's all of these things are happening at once. And that's why I value so much this multi-specialist approach, that I value so much, being able to call you and say, hey, this is what we're doing for downregulation breathing. Like, what are your thoughts? Should I add something else? Or we're able to communicate in that way to not overwhelm the client too with so many things on their plate, but also I can make sure that I'm supporting your work at the same time. And it's just so valuable. And what I feel I find is the patient feels like mental load has been taken off of them, that they are feeling taken care of. They have a care team that is communicating with each other. And that's one less thing they have to do. So it's so beautiful to be able to provide that for especially our complex trifecta patients, but all of our patients.
Absolutely. Absolutely. Yeah. And to, increase that resiliency to be able to then build on all of these different things to improve their overall function and quality of life, because ultimately that's the goal, right? And I think that's where the interdisciplinary care is so important, that it's like, okay, we're not just treating symptoms or how you're feeling at this particular point in time. We want to address that, and how is kind of that big goal, that longer term goal, to actually improve how you're living your life and how, you feel mentally, physically during your day. Because,
Absolutely.
that's what everybody wants
Yeah.
overall.
Yes. And when you have providers that believe that stability is possible with these chronic conditions, like stability, tools, joy is still possible of living meaningfully, that makes all the difference. So I can't say enough good things about you, Eliza. I appreciate you so much for taking the time to be here today and chat with me a little bit about all of these multidisciplinary benefits of care.
Oh, absolutely. Thank you so much for having me and for all the work that you do, because it's so, like you said, just it's so important to work as a team and to have that back and forth, and to have someone like you who we can openly communicate back and forth, not only to get the patients better, but to then at the same time take some of that burden of communicating between providers off of them. So thank you.
Absolutely.
Thank you for all that you do and for having me here to talk about this today.
Oh, thank you, Eliza. Take care.
Thanks, Kelsey. Bye bye.